My name is Dr. Patel and I'm at the Tooth Experience here in Edmond, Oklahoma. We're going to be talking about common questions that I come across. So the first one is, how often should I be going into the dentist for a checkup? Most patients, most healthy adults, we recommend they come in every 6 months, if for nothing else, to just do routine maintenance. Just like a car needs an oil change every so often, your teeth and your mouth need routine checkups. I want you to come in every 6 months. There are some cases and some patients that neglected that early on. We see that they get diseases like periodontitis. That's where we see that they've had bone loss over time and their pockets and their area is deeper than they can get clean with their toothbrush. For those reasons, we recommend a shorter frequency. So what I mean by that is they have to come in every 3 or 4 months, just at the dentist's discretion. It also goes into how your home care is, right? If you're doing a better job, you'll have to come in less frequently. That is the most important thing, is I want you to focus on your home care and just follow up with us every 6 months. That way we make sure everything is running smoothly, everything is flowing well. The other question I get is, how can you improve your oral health? I love technology and I know a lot of my patients do as well. The newer technology in dentistry is helping us improve our oral hygienes, and so relying on that, getting an electric toothbrush, getting a water pick, those kind of things can help with our oral hygiene. In no way, sense, shape, or form is a water pick gonna get rid of you having to floss every day, but it will definitely help. That added water, the added rinsing of the areas will help get all of the last plaque out of there. Depending on technology, depending on the electric toothbrush to tell us how long we should brush, how hard you need to brush, and things like that will kind of help with the oral hygiene. That being said, you don't have to go out there and spend hundreds of dollars on a toothbrush, and it's not gonna save you having a cavity. You could still get a cavity with that toothbrush, but it will set you up for success. The more affordable, cheaper brands that still do the same things that I was talking about earlier. And so just finding what is right for you and what you need. The other question I normally get is, what can I do about tooth sensitivity? Tooth sensitivity happens when the tubules are opened up in our teeth. There are microtubules, small little pores in our teeth, and air goes in there and causes the fluids to move around and causes zing-like pain with our nerve. It is a little bit limited, but you can come into the dentist's office and we can put a sort of film on there that closes up those tubules. That's always an option. The other thing I always recommend to patients that they can do at home is, when they brush at night, brush their teeth just like normal, but spit out all the excess and not rinse. Leaving that film behind gives that fluoride extra time to seep in and remineralize those enamel, and that way those pores can become smaller or close up. The other common question I get is, are electric toothbrushes better than manual ones? Both of those are just mere tools in my sense. I think it depends on how you use them. If you use a manual toothbrush all the correct ways, it can work just as well as an electric toothbrush. The electric toothbrush is there to help you, and I recommend the electric toothbrush to almost all my patients. The reason is that I notice that they're doing something wrong, whether that is they're not cleaning their teeth properly. With the manual toothbrush, the electric toothbrush kind of helps with the motions and things like that. Whether they're brushing too hard with the manual toothbrush, you can use an electric toothbrush with a sensor to kind of tell you to back off a little bit and not brush as hard. Whether I see that they're not brushing long enough or missing areas, the electric toothbrush now with AI technology can tell you to kind of focus in on various different areas, tell you which teeth you're missing. They also have a built-in timer to make sure that you brush for a full 2 minutes, which is what we normally recommend as a dentist. How can I whiten my teeth? There are various different ways. Yes, they make whitening toothpaste. However, the question comes down to, what is the whitening toothpaste doing and where is it being effective? And those whitening toothpastes are good at taking care of the outer layer, getting stain off of the teeth. However, we want to kind of focus on, if we want whitening to focus on the intrinsic stain that's in our teeth, the part that's kind of seeped into the tooth, and getting those whiter. And so what's best for those is an at-home whitening system or kit or an in-office. The difference really being is how quick and how impatient you are. The whitening at-home kits do a great job and are meant to be done every so often. If you want to use that system, you're going to have to be patient, do them every so often and things like that. In-office kits are a lot quicker, a lot faster, give you that result a lot quicker. That being said, it can still take 2 or 3 appointments, and you really need to keep doing it till you get to your desired level. Keep in mind, there is the added sensitivity that comes with it. It is a side effect. We are cleaning out those tubules that sensitivity is associated with, and so it is opening up the pores and the tubes to the teeth, and so sensitivity does happen. It isn't something that is necessarily bad, but can be a post-operative thing that we want to make sure you're aware of. Other questions that I come across is what causes bad breath and how can I prevent it? Main things that I want you to focus on with bad breath is, yes, you need to come into the dentist's office because you could be suffering from a chronic condition like periodontitis and things like that that can only be addressed here in office. But I also want you to focus on your at-home care. Make sure you're doing the things you need to do at home to help your teeth. That way, when you come in every 6 months, it's just a quick routine care here in office. And so the things that you can do at home is brushing properly and things like that. Not only brushing your teeth, but making sure you brush your gums, you clean your tongue, things like that will help with the bad breath. The plaque that builds up on our teeth also builds up on our gums. It also builds up on your tongue. And that's why sometimes you notice that your tongue might have this white layer on it. Make sure you're really taking your toothbrush and brushing that off and keeping that clean as well. And that will really help with bad breath and things like that. Other questions that I come across, should I be concerned with bleeding gums? Yes, yes, yes. The main thing with bleeding gums is it's the first sign of inflammation and gingivitis. If your gums are bleeding, there's something wrong. In some cases, rarely the patient is just brushing too hard and that's what's causing them to bleed. But in most cases, our gums are meant to handle a soft bristled toothbrush and they're meant to be flossed appropriately. And so if your gums are bleeding, more cases than not, it's because you have something like gingivitis or periodontitis, and we need to do the routine cleaning, get that tartar, so get you back to a good point to where we can make sure that your teeth and your gums and your mouth is healthy again. So the other question that I come across, especially with adults, is can I get braces or clear liners as an adult? The answer is yes. If you're unhappy with your teeth, we can definitely help you get things into alignment. And actually, more so than helping you have a good smile and getting things into alignment, it is very important to have your teeth lined up properly because our teeth are meant to be taking on forces in a certain manner. And when we have teeth that are misaligned, what we normally see is that the tooth is taking forces on in directions that it's not supposed to. It's getting hit in manners that it normally shouldn't be. The smaller teeth are taking on forces the bigger teeth are supposed to have and things like that. You should always consult with your dentist on whether it would be good to get things lined up and see what their recommendations are in most cases. What are alternatives to metal fillings is another questions I get. It's kind of an important one right now. A lot of people with metal fillings, it was the gold standard back in the day and they did well as fillings, but I think it's turning out that a lot more dentists agree that the gold standard nowadays is tooth colored filling material, and that is because we're seeing that with the silver fillings, as good as they were, how long they've lasted, we see that the metal expands and contracts at a different rate than our tooth does. And a lot of times when you come into the dentist's office, we can see that there are different crazed lines or fracture lines that are associated with the silver filling. filling. And it's not that the filling is doing that. When we drink something cold or hot, it's contracting at a different rate or expanding at a different rate than the tooth is. It can add the extra forces and cause fractures and things like that. If you have the silver filling, see if they recommend getting them replaced, which ones need to get replaced, and that'll really help avoid any future problems. That seems to be a lot cheaper in the long run of things, because once the tooth fractures, it could mean that we need to crown it, cap it. Some cases we even need to take that tooth out, because at that point we can't salvage that tooth. So guys, those are the common questions that I normally get and my answers. Please like, subscribe, and follow, and hit the notification bell. Also down below you'll find the link to our office, the Tooth Experience. If you're in the Oklahoma City, Edmond area, please book an appointment and come see us.